During the autumn of 2016, the National Autistic Society's South Hampshire branch carried out a consultation into the way in which mental health affects children and adults with autism and how services are accessed in Hampshire. The consultation was supported and funded by Healthwatch Hampshire. We worked in partnership with Hampshire Autism Voice, the voluntary parent care of people with autism group on the Hampshire Autism Partnership Board, and Autism Hampshire was commissioned to facilitate focus groups and one-to-one interviews. Our consultation consisted of an online survey completed by over 140 people and 2 focus groups with parents and carers. 36 people attended these focus groups, which were held in Eastleigh and Basingstoke. There were also a number of telephone interviews conducted with adults with autism who have accessed mental health services in Hampshire. Once the online survey had closed, the initial results were discussed in a professionals focus group. This group consisted of mental health professionals, Hampshire County Council and Healthwatch Hampshire representatives. A report on the consultation is now available and contains recommendations of how mental health services and access to them can be improved. This short film features the views of some of the people who took part in the consultation and is a good representation of the views we received. And I'd like to thank them all for taking part.
I know the lady that came out to me didn't understand autism at all, and at first she thought I presented with mental health problems, but on talking to me she realised that I didn't, and people need to know that they're both separate things. With autism you can have a mental health problem or learning disability as well, but autism isn't mental health and it isn't a learning disability.
I do worry about him because I understand that with autism, depression can go quite hand in hand with it, and you feel like you're going to speak to the doctor and then the doctor will refer you, and then you don't get the answers you want or the answers you were hoping to get.
From the mental health side, there very much is a blurred line. They don't seem to understand that someone with autism can also have associated mental health problems. You either have mental health problems or you are autistic.
I've heard the phrase a lot that we are not an autism specific service, in that because I have another condition they claim not to be able to help me, even though whilst that brings differences and difficulties, it doesn't change the mental health condition.
So he needed a psychologist. That didn't go particularly well. Psychiatrists, some of those didn't go very well, and they just don't listen to you, and they don't understand.
You have to make it look like your worst day is every day, because if you go in telling them what your everyday is like, they will play it down and you won't get any help. And there is a real problem with not being believed that things are or can be as bad as they are.
I've had CBT or cognitive behavioural therapy twice, and both times, although the consultants or the people that were doing the course were trying to help me, it was just information that I already knew. I don't want to say they were teaching me to suck eggs per se, but the stuff that they were asking me to do was just beyond my mental capability. To me, it made no sense at all.
I went to iTalk. You normally get 21 weeks, but I had a year and they still couldn't change my thinking. I've got really rigid thinking with the autism, and they could do things like, if you were just slightly getting anxious, to sit and do colouring or something, to try not to let it get any further, but that didn't work much with me.
Mental health professionals throughout his CAMS experience as well, most of them would ask him to tell them how he felt, to describe how he felt, to tell them why he felt that way. Sorry, he's autistic. He actually can't do that.
The doctors in the past was basically, they delayed things and made things they wasn't too sure how I was feeling, to the doctor that saw from here and now is the only doctor who can understand how I'm feeling, because he's the best at what he does. And what I mean by the best at what he does, he's been trained to be able to do it properly, where the others are not being trained well enough to help me as in my mental health issue needs.
My behaviour may appear aggressive because it's well known in the autistic community that our emotions don't come out as they should do. So for me, when I'm frightened, I can appear aggressive, but actually I'm not, I'm just petrified.
The psychiatrist at the hospital disagreed with the autism diagnosis I'd got from CAMHS, and effectively the entire time I was there, they were trying to push the blame onto parenting and make out that it was a home issue that was causing excessive emotional outbursts, depression, anxiety.
There was a particular episode with my son and a psychiatrist. He just turned and said, "I don't understand you." And he didn't understand him, so how could he treat him? So, because they don't understand autism, and they were quite frank to say, "We don't know anything about autism." Well, then how can you treat my son with a mental illness as well, if you don't understand my son? And to tell my son, "We don't understand you," he's come to you for help. Where does he go from there?
How can they make it better? They could find out a little bit more about autism and how autism people can feel.
When I was growing up and everybody thought it was mental health, even friends and family thought I was mental when I had meltdowns and things. They still think it nowadays because they still don't understand autism or mental health, I don't think. They can't seem to separate the two.
As my son gets older, he is starting to realise that he is different from everybody else. So he's already gone through a bit of self-harm. So we've had meetings and appointments with CAMHS about the self-harm that he'll do, and he hits himself and scratches himself and picks himself, and likes to collect little samples of blood on tissue. So he's starting to realise that everybody's different, and he asks me why his brain is different to everybody else's, and he gets very frustrated and hits himself.
A lot of the mental health difficulties I have had have come out of putting myself under increased pressure, and that still continues. There's both the pressure on an emotional level, but also a practical pressure. So I can try too hard to help other people without helping myself. So in a way, the demanding parent comes out in not looking after my own needs, but trying to meet the needs of others.
He's got to accept himself for being autistic, and hopefully his mental health will get better knowing that he's autistic. So he's got to help himself as well, because he's got to accept himself. And once he learns to accept that he's got autism, he can then start on his mental health.
my assessment, and then it was another 2 or 3 weeks before, for them to decide what they're going to do with this new person that's just had an assessment. It's, I did, for a lot of the time, at that time, view myself as just as just another item on the conveyor belt of the way the system works.
Under the community mental health team, over the 8 months it was before I actually got any kind of therapy, for various reasons I was passed around from person to person, so I never had a single contact who stayed the same. I think I had about 6 different care coordinators in as many months. One went on sickness, the other I was passed around, so I saw a different person every time, different story, different attitude.
I reckon if I wasn't delayed, I reckon I would have had a better present and a better future than what I've already got now. But because things have been delayed over the years, it's made it go up and down, it's made it a bit skew, which is not the point. I should have been diagnosed with it when I was little, but I wasn't, so that's life.
I did want to be referred on to adult mental health services, but the way it's set up, they said that the transition isn't automatic, but I would argue that effectively there is no transition, certainly for someone in my sort of with my sort of conditions, in that once I finished at CAMS, discharged, and then anything else had to go through the GP, so there was no progression from one to the other. It was cut off completely and I had to build it back up.
I find that nobody wants to take responsibility. They listen to you, but it gets passed to the next person and you end up left not knowing which way to go or what's going on.
So a big problem I had with treatment on the NHS was being told that because I have an ASD, there's nothing they can do to help me. I went to the psychiatrist once explaining I had really violent, severe meltdowns, very depressed, but had come out in huge emotional outbursts, self-harm, banging my head, biting, cutting, punching myself, and I was told that effectively that was just part of having autism. Yes, it was in the form of a meltdown, but that was just part and parcel of being on the spectrum. There's nothing they could do because they weren't an autism-specific service, and it was very upsetting.
I think that mental health services isn't the right place as it stands. I think they need a dedicated team working just with autism, because instead of training the whole of the staff to know a little bit about autism, if they had a team that knew a lot about autism and referred them all to that team, I think that would work better.
Now I've got autism-specific psychologist, and he's told me that because I've got autism and rigid thoughts, there's no way that I can change that. But we're working on reducing or changing the triggers that actually send me off on a flea or into a meltdown, so they can work on that bit.
I'm lucky in the fact that I have a service dog. She knows when there's anything wrong with me, not just what she is properly trained for. If I'm not well in any shape or form, she knows, she picks up on it.
people are different and we'll all need different kinds of treatment, and just because we don't fit into one box, that doesn't mean we don't need or deserve to get treatment to get better.
There should be more provision for care of the carers. Because the carers struggle away and the system has to take over when the carers fail. So if you support the carers a little bit more, and that comes with the understanding, then you get a much smoother service.
We have this one particular doctor who is absolutely fantastic. There's not enough of him. He talks to my son like a human being. He actually listens to my son. He takes on board what the parents and the carers actually say, whereas other people, other psychiatrists, don't really take opinions. It's their opinion or no one's opinion. But this present psychiatrist, he's, as my son said, he's very polite. He's well-mannered, and he's just great.
It's nice when you do get professionals that do get you and do get your child, and the relief just makes you burst into tears, because you don't have to fight so hard on that day, but then the next day you start fighting again. So it's nice that there is someone out there. Not everybody is, that they've heard of it but don't quite understand it. There are people out there who do know, and they do know you're not a neurotic parent, and they do know you have issues with your child. So
we've recently started seeing a specialist psychiatrist in autism who is being very good. We're able to talk about different things with him. We're able to change medications, increase doses as we see fit, and he listens to me, and he listens to my son, and he will ask the right questions to get the right information.
Get your bosses to train you. Listen to the carers. Listen to the parents. We're not just being overprotective. We live with it day in, day out. You see them for five minutes and you don't know really what it's like. So you just need to listen and understand. And if you don't understand, find somebody that does. Because at the end of the day, it's to make their life worth living. And if you can't help, say you can't help, and find somebody that can.